Start by thanking folks for joining us. And this is the second time that we're getting together as our cohort, this time virtual. And we're really excited about what we've experienced so far in the cohort. It was really a pleasure to have all of you in the room last time. And I think we were really, really happy to have so many folks who were able to be there in the room and really high attendance. And I think we're heading towards that high attendance again with the webinar today. I know that just about everybody signed up, and if you're just getting in, please join us. Lori, do you want to say hello?
Yeah, hi y'all. Happy to be here. I'm in Brownsville, Texas, the southmost part of Texas, and checking out a really amazing program down here doing some arts and cultural planning and civic engagement. So excited to be down here and excited that I remembered that we had a 1 hour time change. So here we go.
All right. With Lori at a distance, we're going to spend a little less time talking about the NCAAs and the women's tourney and how we're doing with our teams and how broken our brackets are. So it's unfortunate, but hopefully the next time all of us are together, you'll get to see one of us gloat. Wow, no answer for that, Lori. I love it. All right.
Well, I didn't pick Missouri State, but I'm excited for them.
Okay. Okay. Yeah, I didn't pick them either.
I did pick UCLA, so I'm good on that.
I thought they lost.
No, they're in.
They're in. Okay. All right. Well, that's enough about that. And we have some objectives for today for our session. We're going to be really focusing on this transition from thinking about social determinants of health to really focusing on health equity. And I want to just say up front, this is not a giant leap. It's just a little bit of where the focus and work is. And some of it is, in the past, folks have said upstream social determinants of health and really meant something more like health equity. And so we want to really fill in the gap between there with some definition and examples, and have us also bring it down to a practice level. How do we think about it at the practice level? Examine some things that are a little bit closer to what folks are doing. We want to describe some strategies for addressing those social determinants of health in a community context. And really here, we want to hear from you how you're already doing some of this. So we'll be asking for your participation. And as Gina went over, she told you exactly where it is that you can answer some of those questions. And we'll be asking those throughout the day. We really want to make this a conversation and as participatory as possible. And then we also want to explore some upstream strategies for moving towards addressing equity and really focusing on that health equity space that we're in. Just a reminder from last time, we had this definition from structural racism that really focused on understanding kind of the environments in which folks are living and the impact of those environments on their lives. And so this is a nice leap for us as we get into thinking about social determinants of health, because a lot of these things are the very forces that are active in people's lives when they are facing the challenges that maybe lead to some of the inequities that we see. And also, I just wanted to tie it back to day one, that these had a kind of a specific impact. Last time we showed you a slide that had the impacts in Massachusetts and kind of the differences between Black and white health and other outcomes. And this time I want to give you kind of an overall picture, because part of what happens is that we aren't always looking at the differences along 6 or 8 different categories. We're looking at one category, and we want to make sure that we understand that these things have a cumulative impact, and sometimes it shows up in education, sometimes it shows up in incarceration, sometimes it shows up in family makeup, but that these things are acting together on and with each other. One of the places where it's really cumulative is around life expectancy. And so this is not going to be a surprising slide for anyone. This is life expectancy for white females, Black females, white males, and Black males from 1970 to 2009. And every time I show these I get a little teared up because it was in the 90s when I realized that most Black men, their life expectancy was short of age of retirement, which meant that they had worked themselves literally to death. And that's a really sobering idea, because that is the balance of the livelihood of most of us who are on the call are people who were born before 1994, I think. My math's a little off today. So. For those of you who were born after 1994, no disrespect. Part of this, again, is to see this is how we start to look at the lives of communities and what are the differences in life expectancy in a community. Often gives us clues to what is going on cumulatively in that space, and then we can start to pick apart using data to figure out what the differences are, where the inequities are. And some of that is also thinking about what are the larger forces that are at play in that space that really cause these large differences. I was with our friends in Kansas, I think I mentioned before, in January, and I showed them life expectancy there, and I told them this is the first time that I wanted to be a white female. If you look at this slide, it is almost a 15-year difference or so in life expectancy, maybe even a little less, 12 to 13-year difference, and that's quite a lot of time. I want to get all of that time in. So I'll have to develop a whole other idea of who I am at that point. So I'm looking forward to that transition. I want to live as long as possible, and I want to wish that for all of you. We did ask you to do a little bit of homework, and thank folks who got into the Google group and got in there, but wanted to hear from you all a little bit and just give us a chance to see some of this interaction. We've got a question for you. What arrangements did you identify to take on in your own book? And so I'm just going to ask if folks can type that into the chat box, and we'll see how folks are doing with using the technology that helps us to see folks' participation. So take a moment in and start to put in there what the arrangements that you identified in your own work that you might be able to take on. And while you do that, I'm going to take another sip of my elixir. Just want to hear from a few more folks. What are some arrangements, again, at that like hyper-local level that you might be taking on? All right. Give you another like 10, 15 seconds, see if you can add any arrangements. Okay, all right. All right, all right. So I'm just going to name some that I saw that I thought were really interesting. Someone said coalitions, and my heart had little palpitations. Just the idea that this is the way that we work and what that means because we work that way, that's an arrangement. Transportation is an arrangement. We saw a few other ones there that I think were really important for us to call out, but also folks are naming some things that, maybe are ways that we've not thought about, things like sex education in local public schools. Is that the way that this could happen? Are there other ways that it could happen? Webinars are a kooky arrangement. I love that one. Hey, Lori, that was
true.
You.
That was me.
All right. Absolutely, absolutely. And it's something, again, for us to be thinking about. I just want to remind folks that Last time when we looked at effects, it was really kind of what you see, what are the results, what are some of those things that are present, really related to the disparities. And then the arrangements were the things around them that have some relationship to them. And it's also a place where we might be able to leverage some power in making some changes when maybe the effect is really large. Laura, did you want to add anything?
I really appreciated the sort of specificity that y'all had in terms of thinking about your arrangements. At times, we come up with, the effect, whether it's the effect on women of color's maternal morbidity or the effect of housing instability. And I think people have really clicked down into thinking about what some of the arrangements are that lead to those effects. So as we think today and think about our upstream approaches, we're going to be keeping on thinking, not that each individual arrangement is going to solve the problem, but they're really a rich terrain for getting into this problem and shifting some of the ideas around it as well as shifting the effects.
Mm-hmm. Absolutely. We want to be thoughtful, and we'll come back to the AEI as we go through the day, but that arrangements are a good place of leverage for the work that we're trying to do. Want to spend a little time next really just making sure that we get grounded in the definitions of the terms we're going to be using. And these are the same ones we've been doing, but I just want to make sure that we're all on the same page. Health equity, we share two definitions. The first is health equity is achieving the highest level of health for all people. This is a popular one that really just gets it down to that we want everyone to be as healthy as they can be. Our friends from the Healthy People 2020, I can't believe that we're almost there to 2020. We're going to have Healthy People 2030 next to start quoting, but entails this focused societal efforts to address avoidable inequalities by equalizing the conditions for health for all groups, especially for those who have experienced socioeconomic disadvantage and or historical injustices. And again, really important parts there. It's avoidable inequalities, and really especially for those who've had socioeconomic disadvantage or historical injustices, and how those over time play a deep role in what's available for folks and their impacts on health. And social determinants really helps us also to understand some of the ways that manifests itself in terms of powers in people's lives. And so we'll get into that in a moment. I wanted to make sure that we talked about what health disparities are, because again, this is what we see. So imagine if you're walking down the street and there's a orange tree, right? Now, you might have to be in Florida for that to happen, but there's a tree with oranges on it. Now, the only reason that you know it's a tree with oranges on it is because you see the oranges. It's the fruit. It's the byproduct of what's happened there. And so that's the thing that we see. And so often what we're seeing, what we notice first are the health disparities, and we haven't really taken a look at the tree and how it grew, or the soil that it was in, and the conditions that that tree grew in that produced the fruit that we're seeing. That's what we want to make sure. We know the health disparities is the thing that we are facing, and now we really want to unearth the conditions that have caused it to shape and grow in the way that it is. And these are the really simple differences in incidence and prevalence of health conditions and health status between groups. This is before we start to assign any causality or examine justice and what's avoidable, what's systematic. This is just plain differences. When we start to make that distinction, we really are talking about health inequities, a difference in health outcomes that are systematic, avoidable, and unjust. All right. And for me, this is the really part, the part that's really important, is that we're starting to have a conversation about these things being unjust. And that allows us to really think about and really be purposed at doing something about it. If we see differences in health outcome, we may try to attribute it to things that are reflective of the choices of individuals. But when we're thinking about health inequities, it is specifically helping us to think about what are the things on the outside that affect that individual, what are the forces that are beyond their control that have an impact on their health that, and that leads us pretty directly to social determinants, because those determinants are the broader set of things. So I want to get quickly to that definition. And this is a chart that you all have seen a lot. If you're in public health, you've seen this for about 10 years, since it's for the Healthy 2020 folks. Define social determinants of health as the conditions in the environment in which people live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. And classically, it's been separated into these 5 different areas. So economic stability, neighborhood and built environment, education, social and community context, and health and healthcare. And those of you who are very familiar with these will notice that a lot of our work kind of comes together in 1 or 2 of these spaces. And part of the work for health equity is ensuring that we are seeing where there's some some opportunities to work across different social determinants, and especially if we are doing cross-sector partnerships, that we are able to leverage some of the power of those partnerships to affect things in spaces that maybe aren't where we traditionally work. So for those of us in public health, the social and community context and healthcare are spaces that we are used to functioning in. But more and more, to really address health equity, we know we've got to address the built environment, and we may need to think about economic stability and education, and the opportunities that it brings are a piece of that as well. So we see a lot of the work starting to overlap. And so I like to think about this as really a Venn diagram where there's some overlap between these circles, and in people's lived lives, the conditions that are at play very often overlap. And I want to say that out loud, because next we want to really think about these health and dig deeper into each of the 5 different kinds. And in those 5 different kinds, I want you to be thinking a little bit about some of those arrangements that you've already been thinking about. That was a horn outside. From time to time, you might hear some things. We're going to try to keep them as quiet as possible. We might have to stop traffic or something like that. I'm not sure. So these are the 5 areas. We're going to move from those circles into squares. And as we delve into each of these, we'll be asking you to really share some of the arrangements you've identified that maybe relate to one of these social determinants of health. So as we asked you before to think about some of those arrangements that you were thinking about. Now I want you to see, does it fit into one of these boxes? Because part of our work is also thinking about if the space that we're working in connects to a social determinant of health, who else can really support us in making a change in that space? And we want to break these down into slightly smaller categories or subcategories that also look a little bit more like the work that people are actually doing. So for example, with economic stability, the kind of 4 areas that folks have classically worked in and that our friends from Healthy People 2020 describe are employment, food insecurity, housing instability, and poverty. And many of you, I think, have already thought about these, and these play a role in the work that you do. So if you can, are there any arrangements that people are trying to intervene on that relate to any of these 4 subcategories under economic stability? And I know some folks already had named housing and even just like culturally competent outreach to affordable housing. A couple folks talked about anti-displacement. Some folks talked about kind of gentrification and kind of the flip side of that same coin. Any other arrangements around employment or food insecurity or housing instability or poverty in general?
When you're typing into the chat box, make sure that you're typing and responding to the panelists, but also to all attendees, so they pop up on our big screen and we can see them in the room as well.
And you can do this by hitting the down arrow next to the to field above the chat function.
All right. Any others? Okay. All right. Just want to mention here that there's quite a bit of work in health equity around food insecurity and housing instability, because those are two areas that have a really determinant effect on the health of folks. It's really present downstream, but the causes are really, really far upstream. And so particularly for housing, a lot of folks are trying to mitigate the impacts of really historical injustices around housing by addressing the broader policies, like changing zoning, for example, that allows for multifamily housing in the peri-urban community. So not just in the large city, but in the communities right around it. Many of what get called suburban or bedroom communities have housing structure, have zoning structures that won't allow for multi-unit housing, and have lot sizes that basically lock out people who don't have enough money to purchase a really large lot. And so those are two policy changes that allow folks to have access to affordable housing in spaces that don't currently have them. And so many of the towns around the larger cities in the state are starting to address those zoning structures by allowing multi-unit spaces in zones that didn't allow them before, and also changing some of the other restrictions. One of the most insidious restrictions are age-friendly restrictions that folks often think, oh, that's such a good idea. We should have some housing that's just for people 55 and older. Well, they instituted this after the people who lived there were already 55, which means that new young families aren't able to move into those spaces even when the spaces are actually affordable. So it locks out a lot of folks, and it has the effect of keeping those communities in the same racial, ethnic structures that they've been in the past. Some argue that that's not an intended impact, but it certainly is something that it is happening, and something that folks are starting to address at that policy level. Same thing with food insecurity. We talked last time about not just moving from a farmer's market to a supermarket, but really trying to address why it is that people are not having access to healthy, fresh foods to begin with. And some of the ways in which folks are doing that are changing some of the policies around what food is available where, for example. Say if your young people are in school, and what's available for school lunch is a pretty determinant factor in some young people's health. Is often that's the meal that they are getting for the day, and most of their meals are happening there. So how healthy those meals are has a really determined impact on their lives, and also what's available for fresh and healthy foods in the spaces where people are and where they have access to. So bringing it into those spaces.
Can I add one to that, Mo?
Absolutely.
I'm thinking about how racism gets involved with ideas about urban farming. And so when immigrant communities want to farm their own healthy food or raise their own chickens, it's oftentimes not allowed. But then when it becomes trendy in wealthier white communities, then suddenly chickens are awesome. So we have regulations that really kind of show up in ways that are racist and actually keep folks from providing their own healthy, affordable food.
Yeah, all of a sudden hens are hip. Absolutely. And then that changes who's seen as doing that work, as opposed to folks really doing it out of necessity and trying to keep themselves healthy. That's a really good example also for folks who are challenged to provide for themselves the cultural foods that they would want to have when they can't find them in the stores. There was a really good example up in Lowell where they had to kind of fight for the opportunity to farm and use the local community farm to grow things that were more native to the cultures of the people who were living there. And it took a little bit of doing to allow for that to really be a food production space as opposed to just a, community garden where you would have flowers and, sunflowers and things like that. So it is really looking at what's really available. I want to move on and look next at education. Folks already started bringing it up. This includes early education and development, enrollment in higher education, high school graduation and its equivalencies, and language and literacy. Does anybody have a arrangement that they're trying to intervene on that relates to some of these? And thank you, Katie, for bringing up that y'all have the same issue with chickens in Chelmsford. Absolutely. Looks like Shannon is talking about students in school have food or housing insecurity and connecting them to services and programs. And that's one of these that, again, we've got that Venn diagram where these social determinants of health have some overlap. We were just looking at food insecurity and economic stability, and here's an education space that can actually affect both. And we know that hungry kids don't learn, for example. Anybody else working on arrangements? Yes, high school dropout rates and discipline. I was really taken aback the first time I heard the past superintendent of Boston Public Schools say that we don't have a dropout problem, we have a push-out problem. He was recognizing that young people were being pushed out of school more than they were dropping out themselves. And whether that dropping out was someone forcibly making them leave or creating the condition where they could only leave, he was saying that they needed to take responsibility for both. Lack of information provided in different languages. Thank you for pulling that out, Christina. That's a really good example. Any others? Angelique talked about sex education and how it fits into the structure of educational institutions, and obviously the huge health and healthcare impacts for that. We know that HIV rates are really high for young people of color, especially young Black and brown boys, and that they are still experiencing high rates of infection when the rest of the population is in the other direction. And some of that is about what access they have to information and resources, and then where it is they can and cannot. We don't pay our early childhood teachers well enough, and they're undersourced. Absolutely. Part of the work I do is also supporting the early education sphere and working with folks who are serving that 0 to 8. And someone made the comment that, that some folks are paid so poorly in the field that they are experiencing the same issues that the populations that they are working with are around housing instability and food insecurity, et cetera. And while it's important that we're able to engage and involve and actually employ people who are in the service population, our intent should be to do better by them than what they're experiencing. So absolutely, really good example. Tina pointed out that an accent and people being discriminated against based on the accent that they have, and which doesn't at all relate to their ability to do the job. Absolutely, absolutely. And in the education sphere, often that accent, people are using that as a proxy for folks' intelligence or their education or the value of their education. Standardized tests and metrics, that's surely an arrangement, absolutely. You can test that one out by just, if you ever take one of those bubble exams, just do C, 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 C all the way down instead of choosing the letters, and you'll get a score that is approximate to some of what people will do at average. So I'm not asking anybody or telling anybody to do that in their exams. I'm just saying that it happens. Absolutely. The way in which students who could really benefit from mental health support, services and specifically behavioral health services are often disciplined or pushed to disciplinary spaces instead of getting the services. Good stuff. All right, I want to make sure that we cover all of these, so I'm going to move forward to the social and community context, civic participation, obviously things around discrimination, incarceration, and social cohesion. So again, if anyone has some arrangements that they are trying to intervene on that relate to these, we'd love to hear some of those. And I'm just going to talk about social cohesion really quickly because it can often be the link between some of the later down the line social determinants of health and some of the ones that are a little bit further upstream. And just to kind of illustrate that a little bit, I'm going to talk for a moment about how these are somewhat different. So the kind of structural determinants include things like governance and social policy, socioeconomic position, so where you are in a society. And some of the intermediary determinants include things like your material structure, your living and working conditions, food availability, any psychosocial factors, things like that. And social cohesion, social capital are the spaces in between. And really this means that, in a community, can we improve social cohesion so that your social position doesn't determine your voice in that space or how much power you have in that space. If we really want to address the health of that community, we may need to create opportunities for the people who have less power to be heard. And so that can be as simple as changing someone. We're going to talk about this later. So those small P policies, changing when the community meeting happens, when the city council meets, when folks are available for public hearings. Many cities and towns have public hearings on things that are really determinant for folks with lesser means during the workday while they're at work. And so that means that their voices are never there. Want to hear about some arrangements in this area around civic participation? And try to be specific about what those might be. Someone mentioned about coalition meetings that happen during work hours. I was up in Vermont years back and they were trying to do more community engagement. I said, well, let's have the meetings after 6 or 6:30 so people can get there after work. And you could hear a pin drop because they were like, what? After 6? I've got to go home. But it does mean that we may need to do some sacrifices to really engage the folks that are there. And civic engagement can be really broad also. So that civic participation can be participating in your local neighborhood association. Some of you might have been at the chili cook-off in Dorchester on Sunday. That's civic participation. It could also mean doing a voter registration drive. It could be being on a committee for your town. It could be a blue ribbon committee for a specific thing or a task force. Lots of ways to improve civic participation. And with that, some of that social cohesion that allows people to see the value of their participation in the city or town that they're in or the community that they're in, and really bring that to bear in terms of the choices that are available for them.
I want to add too, civic participation and social cohesion, we need to think about young people in our communities, not just young people in the context of the schools that they're in, but are they coming to community meetings? Are they welcome? Are they represented on boards? I'm a part of a city planning process in the neighborhood of Upham's Corner, and they regularly turn out 100 people to a community meeting every 2 or 3 months. And there's no teenagers there. There's no young people there. And they've acknowledged that, but they have not done things to change that. So I feel like that's a significant part of, are young people really a part of this community? Are they representing not just the youth voice, but the fact that they're part of families and neighborhoods?
Mm-hmm. Incarceration is in here, and what happens and what's available to people post-incarceration, that can really be a social determinant of health. If you are locked out of the housing market, the job market, and the social and service structure, it's going to limit your opportunities, and we see a lot of recidivism based on people not having a way to really step back into community. Our friends in Florida just passed a law there that allowed their folks who are returning citizens to gain their right to vote. And now the legislature is trying to push back against that and have people that they need to pay off their fines and other things before they're able to actually register to vote. The more folks are engaged and involved in their communities, the better they're able to act on the things that really are affecting them. There are a couple communities that are examining whether the actual voting structures are the impediment to the community being able to act on and make better their own health. Our friends in Lowell, for example, are examining, and right now there's some, as I mentioned before, some arbitration around changing the structure such that they can elect at the district level people to their city council so that they'd have better representation. Thank you for bringing up, Becky, that communities that have different languages and even some communities with large refugee populations, that language can be a barrier, and interpreters and translated materials, and even just the materials that we have right now can be a little bit of a challenge. All right, I want to make sure that we cruise along here, and our next social determinant of health area is health and healthcare. So here is access to healthcare, access to primary care, and health literacy. And I want to say access to primary care includes the preventative and visits, the well child visits, all the things that help you to actually be and stay healthy before you need to go in for an illness, disease, or injury. So think about all of those things in there. And health literacy, just are folks actually able to take in the information that would help them to actually be healthy. Anybody working in these spaces or had some arrangements that they are intervening that relate to these? Casey brought up that the community health improvement plans and the community health assessment materials were not translated. And it also brings up the question, did the information that go into the community health assessment and community health improvement plan come from linguistic minorities in that space? And that's something for all of us to think about, that we need to be able to take in information from different languages and sources, even if we're not able to translate back. Can that flow in one way? Just ask folks to keep giving us a few more arrangements that they're looking at. Yeah. So even just what's available, really great example there around recovery, what's available to whom, where is it available, access to it, all the different kinds of services. One of the things that's really moving forward in the recovery field now is around having recovery coaches, or what hospitals have recovery coaches, what spaces, community service environments have those recovery coaches and don't. That can really be a barrier for a lot of folks, and it really could be an asset to many folks as well if they had them. Not having them would be a barrier. Doris brought up who is recommended tobacco cessation medication and who is not. That's a real challenge, and it is also a little about who is the person who is recommending it and where is cessation being recommended. So is it a doctor who's the primary vehicle for a cessation med, or even just the offer of cessation access. And if that is the case, then the healthcare structure might be the barrier because the people who they're trying to reach aren't accessing it to begin with. Absolutely. Sophie brought up that trans patients often are avoiding healthcare because of the traumatizing experiences that they've already had with their with providers, and something as simple as not feeling included in what you need to fill out when you show up. You know, that initial 5-minute interaction with the person who asked you to fill out the form with all of your personal information, if it's not welcoming, inviting, if it's not something that that generates an acceptance for you right away, can be a way to check out. And that right there is an arrangement, right? This idea that I need to show up and before I talk to anybody, give you all of my detailed information about who I am and what's going on with me and da-da-da. That's an arrangement. That could be different. We could start with a relationship. I could get to know who you are first. We could have a conversation before I fill out a form. So there are ways in which healthcare by itself has created a lot of arrangements that maybe are things that we might want to take on and look at differently. All right, I'm going to move forward to our last one, which is neighborhood and built environment. Access to foods that support healthy eating and patterns. Again, that wonderful overlap with where we started around economic stability and some of the other spaces. Crime and violence, environmental conditions, and quality of housing. Again, another overlap. And that quality of housing has some really determinant effects. If there's lead in your paint or lead in your pipes, if there's radon in your basement, if there's older houses with lots of dust and dust mites, if there are pests of any kind, all of those things have a huge determinant impact on the health of entire communities. And oftentimes that those structural pieces of where people live are huge. Environmental conditions. I know that part of the communities that I've worked in the past have been the places where all the trucks go through, that the garbage gets dumped, that the factories are right next to where people live, where the air quality is the worst, and all of those things play a role. Beth brought up that historic racism leads to low participation in medical research, and so people don't even know how to work with them. But also, and I would just add to Beth's point there, it's also what's created the neighborhoods that people are living in, and all these things that we just mentioned around environmental conditions that affect them, that are allowed to happen to certain populations and not others.
Casey asked a question, is transportation here as well?
Yeah, and Lori's answer was wonderful. You want to give her your answer, Lori?
I didn't hear that, sorry.
I said your answer to Casey's question about is transportation in this space as well?
Oh yeah, absolutely, absolutely.
Absolutely, yeah. So access to transportation, quality of transportation, what that transportation does. Folks are like, oh yeah, you can get there from here, but people are riding the 2 or 3 buses to get to the services that they need, the job that they need, the school that they need. That's a different kind of access than what other folks are experiencing. Crime and violence also, there are some real questions there about, kind of chicken and egg. Do the conditions that foster these bad health outcomes create opportunities for crime and violence, or do crime and violence create those conditions? Folks have gone back and forth with that. We're really starting to understand that those pressures that are created by these outside forces create the conditions where crime and violence can flourish. It's not causal. And important for us to understand that, specifically violence, the only thing that causes violence is violence itself. And so we can mitigate that by really attacking the spread of that violence. And that things like domestic violence cut across all the different spaces that folks are in, cut across socioeconomic level, racial, ethnic, religious differences, etc. And so they're not primarily, or they're not connected to only one area or any of the other social determinants as directly as I think people used to believe. Anybody working in this space, any arrangements around crime and violence or environmental conditions or quality of housing? Yeah, buses and trucks idling in Springfield. Thank you, Madeline. Absolutely. Like, you could just turn the truck off. You could really just stop the bus. Absolutely. I know one of the things for the MBTA is bunching, where like you'll have 3 buses of the same number and they're all together. And so they end up actually moving slower and stopping altogether and idling together, as opposed to spreading out, moving faster and serving folks better and not causing as much of the idling. Absolutely. Mm-hmm. And housing demand can deter landlords from keeping their homes and making it safe and livable. Poor housing quality and health. Absolutely. Thank you for that one. I think it's really important to see some of these interconnections that the demand in itself and people needing housing can sometimes keep people from doing what they should do to upkeep or being able to demand better living conditions to begin with, or deter them from doing it. I'm really happy with what folks have shared, because I think part of what we need to do is make sure that we're really going upstream and thinking about how do we make changes at that policy, systems, and environment level. There is that stream that folks are so used to seeing from us. I want to just share again those definitions. Downstream approaches are interventions that seek to address immediate health and social needs of populations. Midstream reduce the exposure and healthy risk by improving physical working and living conditions and promoting healthy environments. And really upstream is where we're really seeking to reform the fundamental social and economic structures that distribute wealth, power, and opportunities in decision making. And it's at this level that we're really making the change around policy systems and environmental change. And these are the spaces we want to make sure that we're working at, because here's where we're actually eradicating the conditions that cause the inequities and disparities that we see. So if we saw that orange tree, this grove of orange trees, and we see that the trees don't look really healthy. They're kind of really thin, and thus the fruit are also not growing to the full size that they could have. You're getting oranges that mature early but aren't really that sweet. It's not the quality that you would want. Part of what you're seeing is the result of the conditions that they're in. So can we do things to address those conditions in a way that helps the health of that space? And that's really what we're trying to do in communities, is trying to address the conditions before they have the impact on what we see. So we have some definitions for these, because folks kept asking us, well, what do we mean by policy? Really, these are improvements to law, regulation, procedures, administrative action, incentives, voluntary practices of government and our institutions. And it's important that we note in here that there's differences between laws and regulations. You can throw ordinances in there instead of laws, and the voluntary practices of government, because those are actually easier to change. Sometimes people think of these as procedures. People will call them policies, but it's not something that's necessarily in law. So examine why it is that your town or city does what they do, and how much of it is by ordinance or by law, and how much is it by how the organizations are in place are. There, for the most part, there are things that are much easier to change if they are not an ordinance. And even then, sometimes those things are changeable as well. But we want to be looking at the policy spaces because they have some really direct opportunities to make change. The system space may improve, make changes that impacts elements or social norms of an organization, institution, or system. And I like to think about these as like how things work with each other. How do they work with one another, and can we change how they work with one another for a way to benefit the population that we're working with. The example I use all the time is thinking about schools and the healthy foods that they can provide young people. And that can be a simple change of, you don't have to change the laws or regulations in the city, but you may change what happens to the food that isn't eaten, for example. That's a change in the system. Where is it that they procure the food that they do get? Can they get, local fruits and vegetables instead of having it trucked in from somewhere, and more likelihood of having something that is healthy? Some schools are even growing some of their vegetables and fruits, and something that they're able to serve to their young people, or having young people participate in that and growing some of those things on site. So finding ways in which what's already in place can work differently and work together. Last but not least,
can I add something on that, Mo?
Absolutely.
I think for some of us doing language justice work, it's important to think about language as a system, and something that we can impact in terms of the social norms within organizations, institutions. So really being able to question systemic English only communication as a system.
Absolutely, really, really important piece. I share this example all the time as an organization in Connecticut where their meetings, one time a year, they do the entire meeting in Spanish and translate into English so that the English speakers get a sense of what it's like to be on the other side of that divide. They have simultaneous translation, but the meeting, what gets seen as the normal is the English one. And so what does it look like when you flip that over? And some places are going to simultaneous translation that you can do multiple languages. Some organizations, DSNI, for example, has for longer than I can remember, held meetings in 3 or 4 languages in a way that allows folks to access the information. Environmental change is changing physical, socioeconomic environment and changing the spaces that people are in a way that affects how they use them. I like to think about this as like where things are physically lit, things are used differently than where places are not lit. And you can use that lighting as a metaphor for the change that you make in the environment. So if you make a change in that space, it can be seen differently, it can be used differently, it can be a part of what you're trying to do in the community differently than if it's not seen that way or if you haven't made the change in that space. So I really want to ask you all, what policy systems and environmental change are you affecting? Where is it that folks are making some changes there? And then I'm going to share a few examples, and we're going to dive a little bit deeper into how we move to addressing equity.
So there is a question as people are thinking about their PSU change and what they're affecting. Can you provide examples of social, environment, and economic environment?
Sure, absolutely. So economic environment might be the spaces where folks are interchanging commercially. So do you have a local business association? That's typically a space where you might be able to affect the buying power of a neighborhood. So if 3 shops get together and they purchase from the same place, that changes the economic opportunity for those spaces. It can change the pricing for a lot of places. And it's been a way for businesses to support one another, also that they can get together and try to make change with the communities around them. That economic environment sometimes is already in place. There are chambers of commerce. There are, like in Cambridge, where I lived for a long time, there's a Central Square Business Association, and they put on the flea market and they put on the dumpling festival. This is like a commercial, I'm so sorry. But part of what they're doing is building this cohesion among the organizations in that space, and also trying to create the condition where the economy for everyone is better. But they can also pressure each other to pay a living wage, to support, family leave, all the things that actually are better for workers as well. The social environment, I think, is a really important one because it's part of how we ensure that people are able to engage with one another. So how are we creating spaces where people come together? Where are those convening spaces? Who are the folks that maybe bring those folks together? And what kinds of things do they come together for? And so public celebrations can be a part of that. Public opportunities for education, ways in which people are coming together to share some of who they are, or just even having open spaces where people come together and are with each other while doing their own thing. I'm always amazed at what it looks like when you walk down Quincy Shore Drive and there's like a billion people, maybe not a billion, a lot of folks, and they're from all over, but they're there to kind of do the same thing with each other, kind of sit down, relax, or take that long walk, and you see people from all over the world basically doing the same thing. The same thing that happens in South Boston, the same thing that happens along Charles River, etc. You're creating a space where people will mix with one another, pass by each other, be in connection with one another, and then you can make those spaces into spaces where people convene even more by simply introducing things that allow them to interact with one another. We asked where folks, what kind of PSC change are folks affecting, and we're starting to get a few answers there. I like that, benches at bus stops, more covered bus stops, absolutely. Absolutely. Shared decision-making model for health counseling. Awesome, thank you, Alyssa. Sophie shared the way in which patients can be referred for care. Absolutely. Take a couple more, maybe give the folks another like 15 seconds or so to add what kinds of policy systems or environmental change are you affecting, and think about the things you want to affect as well. Sometimes it takes, a little bit of doing to get there. Somebody is like in the back of my head, town regulations to affect, menthol, absolutely. And menthol is a really important one for us to think about as a health equity issue. And the PSC change that can really impact it is about its availability. Right now, it is the menthol cigarettes are used by 85% of African Americans who use tobacco products. And so this is a really important issue because it's been left out of a lot of the flavor regulation, and thus a population that would otherwise have less access to it has had lots of access to it. And it's been specifically targeted at African Americans. It's also targeted at young people. It's targeted at other racial categories, as well as it's also really hard to give up smoking menthol. It's actually harder than regular cigarettes. And so here we are with a product that could be thought about as worse than regular cigarettes. I'm not sure I can say that in a public health context. And we've done less to regulate it. It's been allowed to target and really affect a segment of the population. So changes in its availability would definitely change the environment. Thank you. The right to garden and sell food in a community. That's a really good one. Thank you, Becky. And again, who gets to create and source and sell food is a huge issue. It's something that in other countries, folks have fought for, that they are able to not only farm for themselves, but farm as a way of providing for their families and supporting the community and bartering with each other. It's in some places it's enshrined as a right, and it's something that in communities now we're starting to see some challenges to whether or not folks are able to use community gardens, which are public spaces for the ability to garden and then to sell the food that's there. It's a important way to think also about supporting some of and addressing some of supporting folks who are addressing food insecurity, but also addressing inequities in socioeconomic level as well. Zoning policies, thank you, Kathleen, for bringing that up, and change some of the stigma of illegal rooming houses, absolutely, thank you. It's really also about what gets named what. In some spaces, we just call that doubling. You have multiple families sharing the same apartment, or tripling. And even then what that means for the folks who are there and whether or not they get the benefits that they should. I'm going to share a couple just interesting examples, and then we'll get moving. Thank you for the sharing that folks have done. Some of our friends in other places have started to do some really innovative things. In San Antonio, one of the independent school districts, they noticed that that basically they were needing to improve the conditions that the students and employees were in, and this only really happened because they started to address their suspension rules. And they're suspending kids, but not ever really diving into why those kids were having behavioral issues to begin with. And when they started to look at that, they worked upstream from the behavioral issues to really what were the trauma that the young people were experiencing at home, and how could they use a trauma-informed perspective to really prevent some of those negative health and behavioral effects, and then the on effects of academic misperformance. And so having some mental health supports, really thinking about who can provide families access to social service and economic supports, and really trying to improve safety and some of the economic stability actually helped young people in reducing their behavioral and discipline-related suspensions. And so really important that they went upstream there, because they figured out that they were suspending kids for no reason. The hospital in one of my favorite stories is hospital in Columbus figured out that it wasn't enough to try to address what folks were walking in with if they were sending them back to the place that caused them to have the condition to begin with, which sounds like so obvious. And that's part of our work, is that this stuff is kind of obvious. And so they did literally a housing intervention. And so part of what folks were getting prescriptions for and the opportunity to participate in were a home repair program, a rehab and home ownership program, a home construction program, some career development and home development programs. And part of this was to address that there were vacant lots and vacant homes in the community, but also that they were sending people back to healthier environments, and then those folks weren't coming back to them sick again. So really important that part of any of the systems that we're working with, that they really examine what the impact is that they're trying to have, and how is it that they can work upstream from the problem that's in front of them. I'll share one more. Our friends in South Carolina have been really active in addressing some of what they see as problems, and then thinking about how some of the neighborhoods that they're trying to work in maybe could have some changes. And so one of the things that they did in Spartanburg was really to think about how are the green spaces related to the affordable housing options that are in place, and where could they put the healthy foods so that they were in the spaces where the people who had the highest need were. And so part of that was supporting a minority-owned healthy food hub in a space where people could go, creating safe green spaces that were adjacent to affordable housing, and providing training and employment opportunities to the residents that were in place, and making sure that those folks benefited from the opportunities that they had there. Those are some examples, and one of the tactics that I think folks are really starting to understand is to use the purchasing power of the institutions and organizations that people are members of to the benefit of the community that they are trying to impact. So if you have to buy, printing services, can you buy it from a community-based printer who is in the community that's suffering the poor health outcomes that you're having, thus supporting the economic stability of that community and the people who are employed by that producer. If you're buying paper cups and paper goods? Can you do that locally and support the organization that employs people locally? All these things that are really values that you have within the spaces that you have power in. See work upstream. As we mentioned before, really you've got to make sure and making sure that there's some PSC change connected to the policy back to her.
Yes, so she'll
Okay.
let you know when you advance the slide.
All right, tell me when to advance the slide,
that'd be
Laura.
great.
Now?
Yep, now. All right, beautiful, thanks. I thought it'd be useful at this point to think about the difference between first order change and second order change as we think about the scale that we're intervening at. And they're both critical. I think there's ways that second order change feels our work multi-directional. First order change is when the individual parameters change in a fairly continuous manner, but the structure of the system doesn't alter. So this deals with within the existing structure, you might do more of something or less of something, and you might restore balance to something that is more ideal. So thinking about offering more multilingual services, or having more staff of color, or offering better sex education within an existing structure. Second order change, the system changes qualitatively and in a discontinuous manner. Second order change is creating a new way of seeing things completely. It's irreversible. It requires new learning and often begins through the informal system. So we'll look at some examples of both, but thinking about second order change, it's like if you've done something that's a second order change, the story of your work or your organization or your community is forever changed. It's not the same story. You're not slowly working towards a decrease in tobacco use and now you're achieving that, but it's some really right turn, left turn way that something has changed significantly.
Laura, you went mute for a moment there.
Okay, yeah, that was because I was trying to advance the slide thinking I had that. Can you go to the next slide?
Absolutely.
All right, beautiful. I'm not going to dig too deep into this. If this is something that interests you or feels useful, we can certainly, this will come to you in the slides, but I think the contrast here can be helpful. So thinking about the second order change is really multi-dimensional, multi-level, qualitative versus quantitative, thinking about not just a change in content, but a change in context, and that idea of irreversible change, change that results in a new state of being. So there's ways that first order change is important, and there's ways that when we imagine second order change, people will tell us that it's irrational, that it won't work, that it's too much, because it's working with a different logic. And sometimes that different logic is a logic that makes a lot of sense to the communities that we're working in, and maybe less sense to the organizations we're working with. So when we think about something that might seem irrational, it might seem irrational to the powers that be in ways that are very important to the folks who have been disempowered. Can we go to the next slide? So I want to use an example here. This is what we call the door story. And this is not the door. This is another picture that I found on the web because the organization that is involved in the door story will remain anonymous because it's a local organization. So I just thought this was the kind of door we're talking about in this story, thinking about first order and second order change. My colleague, Kenny Bailey, was working with a local multi-service organization in Boston, and they were concerned that they had seen a falling off of involvement from the community of people coming to use their services. And so they were concerned that they weren't offering the right services, or perhaps they needed to offer services in more languages or offer different services. So they were dutiful and they hired some consultants, that's where Kenny came in, to go talk to community leaders and community members and find out what services they should be offering or what they should be doing differently. And the stories that Kenny heard were about the door. The door was symbolic. It was a symbol and a thing. It was something that the way that they entered the organization felt disrespectful. they had to be buzzed in. So they were standing outside having to tell their business, why do you want to come in? I have an appointment. It felt like the organization was suspicious of the community, that the organization didn't feel safe, that you had to be buzzed in, you had to talk to a stranger through an intercom. And so there was many stories of people just saying, we don't feel comfortable going there. So Kenny pitched a second order change. He went back to the organization. He said, told them the stories that he had heard, and he said, we need to invite the community to basically knock down the door with us. We need to either literally or symbolically change this door, and we need to do it with the community, and we need a different welcoming process into this organization. That was a second order change. And unfortunately, and this is a challenge that some of you all will bump into, the organization couldn't hear that. They thought that was weird. They really just wanted to know what new services they should offer, or what new ways they should offer services. But I think this is an idea, right, of what do we mean by that sort of transformational change? The community wanted a different relationship with that organization. They didn't want different services. They didn't want services in different languages. They wanted a different relationship, and that's what I mean by second order change. So let's go to the next slide. Can we go to the next slide?
1 second.
We're trying.
All right, cool.
All right, there it is.
So I want to think about two levels as we think about the sort of changes we might be working on as we challenge arrangements, and by challenging arrangements, challenge ideas and change effects. We call them at the studio small p policies, policies that are often unwritten and uninspected, and often based on what we call small c culture, the informal cultures of systems, scenes, and daily life. So I'm not talking about the sort of cultural work that you might be doing to better meet the needs of the new Syrian population that's moved into your neighborhood, or the Cape Verdean population that your organization is based in. I'm talking about this small c culture, this kind of very quick moving ways that our systems work, that our meetings work, that our daily life works. Small c culture might tell you what's appropriate to wear to a meeting, or the fact that if we're meeting at a certain time, we expect to have lunch, or that certain people are at the table and certain people aren't. So this notion of small c culture is something that really can be addressed and really is getting in the way of some of the change that we're trying to create. One of the ways we connect culture and policy at the studio is we talk about culture as the policy of the irrational. So often, we think, policy is this very rational thing, and we can just organize and build our base and change policy. But there's so many ways that we relate to culture as sort of, this is the way things are. This is just how it is. What you're proposing sounds preposterous. It's impossible. And so I want to use this notion of small c culture to kind of dig into how we can create some second order change. Can we go to the next slide?
Absolutely.
So Mo and I had a great lunch at a Cape Verdean spot near where I work, and we started to think about some of the cultures that would be really useful to interrupt in this notion of small c culture. And we thought about organizational culture, nonprofit culture, city planning culture. Some of these things are things you guys have already brought up, right? Meeting culture, when are meetings happening, right? Who's there? What's our city agency culture? So I think the first thing that would be interesting is if y'all can start to add some nuance to these things. So pick one of these things and say, what are some elements? What are some of the arrangements within this culture? What are some of the arrangements within public health culture or nonprofit culture?
Or New Englandy culture.
Or New Englandy culture.
I like that one.
Arrangements within one of these cultures that interest you. Beth added medical culture to our field. Thank you. What are some of the arrangements within nonprofit culture? Let's get specific. Oh yeah, definitely. We talked about that at our last meeting, right? Philanthropy and funding culture, grants. Having to grant report. We have some arrangements within Nonprofit culture, the expectation that staff of color are those who serve clients of color. Absolutely.
Yeah.
Lower levels of pay at the ground level. That's a really sturdy arrangement within nonprofit culture. And the many arrangements that lead to so many nonprofits having white staff at the top that expect multilingual employees to act as interpreters, unpaid interpreters. Interesting. So we have, I think, in this idea of nonprofit culture, Marlene, these ideas of what it means because we're helping and they're receiving help. And they should be grateful for our help and not critical of our help, right? So within the arrangements of nonprofit services, we have these ideas about people who receive services. Some challenges to the city agency culture, thinking that equality is more important than equity in programming reach. If we just put something in different places, that seems equal and it's not addressing other issues of equity. Culture of scarcity. Can you say more about that, Ann? New Englandy culture. You don't talk to people you don't know. There's only one exception to that, and that is the first day of spring in Boston, when everyone starts talking to each other. It's like one day a year we talk to each other. Or of course when the Red Sox win, the World Series, but that's also very within the New Englandy culture. All right, I think those are some great examples. And you've added some other small C cultures that you'd like to address. Does anyone have another example of small C culture, like medical culture, New Englandy culture, that you want to address? Oh, liberal, progressive culture. Oh, culture, the arrangement of requiring advance appointments as part of health field culture. Thank you. All right, this is a rich field. I knew y'all would be all over it. Fawning over wealthy donors. Good times. Yeah. Having to dedicate resources towards donors that we're not dedicating towards our participants. Not asking for more, right? Expecting scarcity. Thank you. Expecting that we'll have to work extra, that we won't have a great resource where our participants will feel comfortable with great food or air conditioning or beautiful windows, outdoor spaces. Oh, the culture of emailing. Thank you. Let's keep going. Let's go on to the next slide as we kind of dig into these small C cultures. I want to think back to our critical point here of addressing systemic racism and thinking about how does racism get embedded within these cultures. And you guys have already kind of pointed out a couple of these, but let's think into that a little bit too. How do we see racism embedded in our organizational culture or in our city planning culture? Feeling comfortable with having the same people at every meeting, coalition, event, having data that's not inclusive. I think about some of the things you guys have talked about in terms of hiring practices, right? You're really thinking about who do we consider our professionals, who are the leadership of our organizations, or who are the health practitioners, right? And how racism gets embedded in our hiring practices. I want to think about too, when we thought about ideas, arrangements, effects, these arrangements that yield white leadership, these arrangements based on ideas of what we value in terms of, say, educational attainment versus experience, and then how they further racist ideas about who is a leader, right? They further racist ideas about who's the most qualified candidate. So not only do they continue to get us white candidates, but they actually make us think about white people as leaders in a way that's racist. All right, lots of great examples here. Thank you so much. Communities of color not being seen as assets. right? This idea that if you're a client, if you're receiving services, you're somehow a deficit. You're not someone that has tremendous ideas about solutions. And I think about questioning the arrangement of prescriptions, the way Mo talked about and the way one of our participants talked about prescribing pain. In that case, she was thinking about people prescribing less pain for women of color, you know, and this notion that someone doesn't know their body or they don't know what their community needs. And how could we change that arrangement? How could we rethink who gets to prescribe what for whom? Someone mentioned an arrangement earlier I want to bring up again here too, is this idea that if you've taken that training, you went to that health equity webinar, it was awesome. Now there's this notion that you can't tell me anything because I'm trained, right? So we have an arrangement that's trying to get at racism, and the outcome, right, if this arrangement isn't really thought about and inspected, is that now you can consider yourself trained. Now you don't need to continue to question your own white supremacy or that of your organization. So maybe we can dig a little bit into the second question in terms of what's, you know, we've thought about these arrangements. What are some of these effects? How do these arrangements, these kinds of elements of small C culture affect the communities that we care about and that we're working in? And how do they influence the social determinants of health? Bringing it back to these effects that y'all are fighting, what are you seeing as the effects of this kind of meeting culture, city agency culture, health culture? Yeah, great. You know, I think we've talked about coalitions have come up a couple of times, right? So this idea that coalitions are often grant funded, getting to that arrangement, oftentimes are like who can come to the table, usually organizational staff, usually folks who, even if they're representing, say, parents or folks who have HIV or folks who are experiencing or needing some of our services, they're representing a very white specific perspective on it. And you all are experiencing those injustices of having your communities not, their experiences are not being included, and so the services are not what's useful for them. I think this attitude of if they cared, they would do X is really interesting. It comes up with parents, it comes up with immigrant communities, it comes up with young people, it comes up in so many times when we think, hey, we communicated and they didn't come. They're not at the table because they didn't come, right? Instead of thinking about communication as a two-way street. And one of you all talked about this in the arrangement that you're trying to challenge. Not just how can we communicate better, there's that, that's really important. How can we communicate in multiple languages, or how can we put this meeting at a time that folks can come, but also how are we listening, right? How are we listening? How are we seeing communication? What do we need to know? What table should we be at that we're not at? Even if it's a table in someone's house, right? Or a table that's outside in the park, like where are people talking? How do we learn about what's important to them? And not just say, did they hear us and did they come? And therefore, we don't need to care about them. So getting back to these upstream issues, right? Thinking that we refuse to address the upstream issues. We don't take the time to really think about how racism is threaded throughout this. And I think those are the pieces, right, that we're trying to think about in our organizations, in our coalitions. How do we challenge that? So it's not just, I went to that workshop. How do we challenge that in ways that can bring about second order change? That aren't just offer that workshop or aren't just, I was at a meeting recently, some of y'all are thinking about language justice, and they had two translators, which was great. One was a Spanish language translator and one was a Cape Verdean Creole translator. And they stood up at the beginning of the meeting and asked if people needed their services. And then a city official stood up and said, if you didn't understand them, don't worry, it means you don't need their services. So this is telling the rest of us who are monolingual English or perhaps bilingual, we don't need to understand the community members that are speaking Creole and Spanish. We only need to understand the presenters and other folks who speak English.
Wow.
So thinking about all the different ways that we can challenge these small C cultures and challenge these arrangements. Let's move on to the next slide. So as we're starting to move towards the end of our webinar, just to pose to you as you continue to think about your work and these arrangements that you're challenging, some of them, you know, as big as housing and transportation, some of them very specific ways of getting at unfair hiring practices or getting sex education to our young people in the arrangements that make up small C cultures. And I know that's a hard question to just think off the top of your head, but many of you are already thinking about it. And I'd love a chance to kind of close out with hearing your voices about how you're going after that. And I think there's one other question on this slide. Is there another question that pops up? Thank you. Yeah, so challenging this propensity to put the weight of anti-racism work on folks of color who are already experiencing the weight of racism, challenging that. Oh, a very specific example about assuming that we're English at the checkout. Yeah, really addressing our grant proposals and how can we make sure that we can provide funding for community members if we want them to be at the table. How does that help bring people? How does that help make it more accessible? There are grants that don't even allow food for community meetings as an expense. And we want to have community meetings in the evening when families can come, and then our grant tells us we can't even feed them. That is some white culture. Oh my goodness, come on now. Gina says it's time to wrap up. We could go on and on and on because there's a lot of content here. We want to thank you guys so much, and I'll hand it back to Mo to do the final wrap up. But thank you so much for thinking with us, and we're really excited to continue this thinking as we move forward in our next gathering.
So this was a really quick and really full hour and a half of examining the social determinants of health and the link to health equity. I hope that folks were able to make that that path from the specific social determinants of health as forces in communities that affect the populations we're trying to serve, and as we're trying to address those spaces, how we're using the arrangements that are affected by small C culture and small p policy to make that change. And I really appreciated how folks jumped into the conversation. There were so many comments. We obviously didn't have an opportunity to highlight all of them, but we really, really appreciated them. I know that I'm going to print these out and look through them to better understand the entirety of the conversation and what people were able to put there. And I'm looking forward to seeing you all soon, because we're going to get back together and be able to pull the thread of these things together for our next session, and also be able to make some of the linkages. We're really excited about the things that folks are already working on. And so I really want to ask people to just, as you are thinking about this stuff, as this stuff is coming up for you, please participate in the Google group. We're going to be all in that. And if you have questions or thoughts that came up from today's conversation that you want to follow up on, we'd love to see that conversation happen there. I feel like I'm Gail after the Oprah show, and we're going to have that conversation afterwards. So please go on that Google group and keep the conversation going. I managed to get through one Mountain Dew in the course of our hour and a half. And so I want to thank you all for keeping it so interested and vibrant that I didn't have to go to my second bottle. All right. Gina, I think, is going to help us close out for the day.
Yeah, so Kelly is actually going to launch our, excuse me, our feedback questions. So we're asking you to stick around so you can answer those. Again, all the feedback that you give us will help inform future trainings and also the progression of the cohort. And if we will continue to do it. And so we're really excited about today's participation. I think this is one of the best webinars that I've been a part of for the Community Health Training Institute. It's really exciting to see how excited you all are about this content. The questions and comments that you're posting are really help enrich the conversation. And I think somebody asked if they could have access to the comments as well, and I don't see why we couldn't include that when we send out the recording. Again, this session was recorded, so we're going to send that out in case you wanted to listen back to things that came up throughout this webinar, along with the slides as well, if you wanted to look at those as well. So I see the answers are coming in for the polls and the feedback questions, which is great. We will be in contact with you between now and the next training. And I believe the next training is April 23rd, and we will see each other in person again. But because there is a solid month between now and then, we want to make sure that we're continuing to communicate via the Google group. Mo and Lori are going to continue to interact with you as well in that Google group. So if you have questions, if you want to connect with other people and continue this conversation, we ask you to participate in that group as well, because it's going to enrich this process even more. So again, answer those feedback questions. Those will be really helpful. And if you have any questions for us between now and then, please feel free to contact us. You have our emails at this point. We all have been in contact in the Google group as well. I'm trying to think if there's anything else, but if not, we will see you on the 23rd, and we're very excited to see you. So I'm gonna transition out in terms of video and give you guys some time to finish up those feedback questions. All right, thank you, everyone. We'll send out emails and contact information for those that didn't get a chance to fill out feedback questions. And we will see you on the 23rd.